Leader of the Official Opposition.
Thank you, Honourable Speaker. The Doctors of B.C, representing 14,000 physicians in our province, took the rare step of issuing a statement yesterday saying how deeply concerned they are by the Health Minister's recent comments that nurse practitioners provide better care than doctors. Family physician Jennifer Lush says, and I quote, "It was a profound slap in the face to every physician. It's smoke and mirrors, and it's a strategy to sow seeds of division rather than focusing on the real issue, which is that we have a crisis in BC of 1 million people not having access to a family doctor," end quote. So instead of smoke and mirrors, will the minister today acknowledge the value of family doctors, end the divisive rhetoric, and take action to deal with a growing crisis of healthcare in our province?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, the member was there. The first thing I said in answer to a question on physician's assistants was, I'm not saying, I said on the record, I'm not saying that care is better. And that's the case. In fact, family practice doctors are the heart and the foundation of our primary care system. 6,800. Over the last number of years, there are 600 more family practice doctors in BC than there were before. There are also, and we talked about nurse practitioners who have also a very significant role, 400 more nurse practitioners. And they are working together to provide primary care. The reason you know that I don't think that is I didn't say it. I don't believe it. And I think family practice doctors do an extraordinary job in BC, particularly during this period of pandemic, when we transform the primary care system together to continue to provide service for people. So let's be clear, I've said virtually every day, family practice doctors are critical in BC. They play a key role in BC. And we need to respect them, not just by saying so, but by doing what we've done with primary care networks, which is giving doctors and divisions of family practice control and responsibility on the provision of primary care in their communities.
Leader of the Official Opposition, supplemental.
Well, thank you very much to the minister. And we should be perfectly clear about who heard the comments and how they were said. Doctors were watching across British Columbia, and their comments were based on what they heard, not what I heard. So to be clear, they issued the statement. They took the rare opportunity to issue a statement about what this minister said after watching his health estimates. Doctors are upset and angry about what they heard this minister say. As Dr. Anna Wolak says, and I quote, "The minister's comments confirm that we are undervalued as people and as physicians. It's an actual gut punch," end quote. Not my words. And I was in the room with the minister while doctors were listening and sending in their comments. Almost 1 million people in British Columbia do not have a doctor. And this minister continues to say everything's okay. Doctors are closing their practices, and many more have indicated they will do that because they feel undervalued. Will the minister get up today and at least acknowledge the impact of his words and take immediate action to fix the crisis in primary care?
Minister of Health.
Well, thank you very much, Honourable Speaker. And that the circumstance, the Leader of the Opposition talks about unattachment. There were twice as many unattached people in 2017 as in 2003. The rate of unattachment increased by 70% in that period. What that tells you is that that's a trend over a period of time. Only once in those 14 years did attachment get less. There were modest improvements in 2018 and 19, and the pandemic's had its effect. Every day, we should celebrate the work of family practice doctors, and every day I do so. I understand what it means for our families and for our communities, and the need to provide care to patients. It's why, under the most difficult of circumstances, in this past year, the year ending March 31st, there were 1.5 million more visits than there were before the pandemic, in spite of those extraordinary difficulties. if anything tells you about the commitment of our family practice doctors to our province, to their patients, and to our healthcare system, it's that. And I and the government will continue to support them.